Are you a doctor?
Okay, so we are live. Hello, everyone. Today we have Dr. Praveen Chandra. He's the chairman of Interventional and Structural Heart Cardiology, Heart Institute, Medanta Hospital. And today we have him here to discuss more about why heart attacks are happening more to millennials or Gen Zs. Because we know on 29 September we celebrate World Heart Day, so it's a day that was made because we wanted to spread awareness on heart diseases and how we can keep our heart healthy. So today it will be a very insightful session. Please go ahead and ask your questions. I have a few questions with me that Dr. Praveen will be answering. So Dr. Praveen, over to you. Do you want to say something before we go ahead?
Yes. Good afternoon to everybody, and it is a pleasure to be here on this, forum that we are going to discuss about how to keep the heart healthy, what are the issues, and how to just avoid a heart attack. So, in
Right.
the next several minutes, we will start this discussion. So, I am very, very happy to be here today.
So let's just start with a very simple question. We've all read in school how the arteries work, but we don't know actually how heart attacks happen. And I think one should be at least aware of, the basic terminologies of, what happens when someone has like a heart attack.
Okay. So basically, heart attack is a condition which is one of the most severe conditions of the heart. In the time of a heart attack, patient develops severe chest pain with sweating, with ghabrahat, with sense of very uneasiness and also palpitations. And this is not responding to anything. He is drinking water, he is trying to lie down, he is trying to sit, but nothing is responding. That is the time when people should start suspecting a heart attack. And when these heart attack happens, then it is very, very important to understand that it is a heart attack and go to the nearest possible heart hospital or a facility where the treatment can be done quickly. Because in the first 1 hour, if the patient do not go to the heart center or treatment, then the chance of dying is about 15 to 20%, which means 1 out of 5 patients will die within the 1 hour or 1.5 hours. And this is why we call this as a golden hour, the golden hour of life, the golden hour of the heart. So, first and the foremost important thing is do not avoid these symptoms. These symptoms are important, and in case it is happening to somebody, he should be taken to the hospital. So, someone should help him go to the hospital, not that he should drive out and go or walk out and go. Somebody should help him go to the hospital. He should not be walking too much. And then once he reaches the hospital, the first thing is the doctor will take out a ECG. And based on the ECG, he will tell, okay, heart attack is happening or not, and maybe some blood test and things like that. And then the decision has to be taken very quickly. The doctor also has to say quickly. It is not that the patient has to reach. It is very, very important that the doctor should be available, and he should see the patient in the next 10-15 minutes, or the team doctor, whosoever is there available, should see the patient, do the treatment. And the best treatment in today is for a heart attack is angioplasty, which is putting a angiography and doing a stenting over the blockage. Because during heart attack, one of the heart's artery gets blocked completely, and that has to be opened immediately. And when it is open, the blood flow starts and everything is okay. So that is what we call as that we abort the heart attack. The heart attack, if it happens, it will damage the heart and will take lives.
So, is there a first aid? So, for example, if something happens in front of me, like a person is getting all the symptoms, and then the heart attack happens, he get that first attack. So, I mean, obviously, I'll have to, rush out. And during that time, is there anything that I can do to help that person
Yeah,
till
yeah.
the time we
So
reach the
basically,
hospital?
yeah, absolutely. What is the first response which people should know? So the first
Yeah.
response is make the patient calm, try to make a plan where to go for as fast as possible, and on the same time just give him some little bit of water, not too much of water also. And if there is a tablet of aspirin, this aspirin tablets are generally available at home. Dissolve one tablets of aspirin in a glass of water and give it to the patient. Okay. And then if somebody has sorbitol at home, which generally people will not have, if somebody is a heart disease patient in the home, then they will have a sorbitol tablet. It can be given to the patient below the tongue, and then let him calm down, relax, rest, and let him. He should not be walking too much, or walking the stairs and stuff like that. So resting, calming down, make him sit on the chair, make arrangements for the patient to be shifted, and give a tablet of aspirin if it is available, and then that's all you can do or you should do in the at home. However, sometimes patient can suddenly become more serious at home. They are not able to breathe, they are suddenly unconscious. So when they become unconscious, then the advice is that the patient should be made immediately to lie down on the floor, maybe on the ground itself, and then do the pumping of the chest and give some artificial respiration by mouth to revive the patient.
Okay, okay.
Okay.
So, doctor, we have seen that the cases are increasing among millennials or young adults, the Gen Zs. We have also seen, like, after they've just come out of the gym, they've worked out a lot, or I don't know what are the reasons that you can tell us, but the cases are increasing. So, do you want to comment on that? That what can be the reasons, and have you actually seen young people coming to you complaining of chest pains and heart diseases?
Yeah, many young people come to us with chest pain and heart attacks also sometimes, and generally the incidence has been on the rise, and we see them very often, and they come in sometimes very critical condition. Sometimes the heart is so much damaged. So this should not happen because they are in the prime of their life, and we have to protect them. So how to do that? So basically, lifestyle is one of the very important factors which is leading to this trouble. And in the lifestyle, one of the important things is that controlling the diet, which is like avoiding processed foods, avoiding all those foods which are containing a lot of sugar, a lot of salt, and also fried foods. All those things in large quantities or in regularity is not good. Sometimes you can take it. And then, apart from the diet, it is increased intake of vegetables people should have, which people are not doing these days, and fruits. And then, of course, exercise. Regular exercise is very important to maintain the health of the heart. So these are two basic things. Then checking the blood pressure. Many times people never check the blood pressure. They go to the gym, they go to their work, and the blood pressure is not checked, and the BP is high. And even if the BP is high, they don't want to take medicines, thinking that they will be dependent on medicines. However, having high blood pressure is a very serious problem. One should not avoid high blood pressure, one should not hide blood pressure, they should get it checked on a regular basis. Then, people who are smoking is a very important risk factor for heart occurrence, should be avoided. Doing good sleep is a very important part of our health, so sleep should be adequate. Stress should be reduced, mental stress. And you were also mentioning about the broken heart syndrome. Basically, yes, it is a broken heart syndrome is a known entity where sudden shock, sudden grief, sudden trauma to the mind leads to the heart getting weak. And when the heart becomes so weak, it is known as broken heart syndrome. However, if you make everything okay, if everything is streamlined, then the heart can also get better. So it is not that he will not get better anymore. So we have to take care of these people, and then their psychology, their mental status, and then their heart also becomes much better.
Right. So you mentioned about broken heart syndrome. We recently read a news that Queen Elizabeth died of a broken heart. So maybe like you mentioned, like if there's a sudden grief or trauma, then it can weaken the heart. So in order to keep your heart strong, not only you have to keep stress away from your life, eat healthy, work out, but your mental health matters a lot as well. You need to look after your mental health and see that you're happy. And if you see anyone of your friends or family, if they have mental health issues, then it's important that you address them, because it can lead to a lot of other diseases as well. So like you have mentioned that so we know that what we should do in order to keep our heart healthy, and what we should not do. But like, can you give like a one or two tips that we can look after our parents as well, because our parents are also working. They are they are like stressed about our lives, their lives, so they don't really care about their health. What can we do as their children to make sure that their heart is also healthy?
First, of course, they should remain stress free and keep talking to them, communicate with them, understand their, what they are, kind of going through. And so,
Hmm.
all those things at a social level should be the social health also very important. Many times in
Hmm.
families, people don't talk to each other. So, because everybody is busy. So, there should be a time when they come together. They should, communicate with each other, sharing of pain, sharing of sorrows, sharing of difficulties is very, very important. It gives so much relief. Okay. So in the family, I think this is very important. And children should understand the parents, and the parents should understand the children. That's very important. Then the next thing is, of course, one should see that they are also eating in time, eating healthy food, etc., and taking care of them. Regular exercise. Many times when people are at an advanced stage, they don't exercise. They should also exercise. So if they are not able to do that, one should try to take out time and figure out how it can be done. Then
Hmm.
the next thing is their checkups. Many times, we don't check. As I was telling, blood pressure checkup should be done once in a month or once in 6 months if everything is okay. Sugar control, sugar checkups. In case there is a blood sugar patient, his sugar should be controlled. He should be eating well and taking the medicines on a regular basis. So all those things are very regular things which has to be done. But regular checkups is very important, and that is why many times people suddenly they come to know suddenly heart attack happened and there was nothing. So maybe there was something which was not detected. So that sugar checkup, cholesterol checkup through the blood test, and getting a blood pressure check done, and getting sometimes other invest checkup by the physician. Sometimes the physician should examine also to see if everything is going all right or not. If this is done, I think 90% chance we are able to avoid a heart attack.
Okay. So now that you have mentioned that regular checkups are important, I want to know, are there any specific diseases that are interlinked to heart attacks? So, for example, you mentioned that BP. If you need to keep your BP in check, cholesterol levels also. So, for example, I am a healthy person. I eat healthy. I exercise daily. I have no stress in my life. But then there's a person who has diabetes or blood pressure issues. So, what are the chances that they are more prone to heart attacks and I am not?
Yeah, so anybody who has pre-existing diabetes, or who has high blood pressure, or who has a family history of heart problem, then there is a higher chance of this person to develop heart attack or heart disease in the future. So that is why these people have to be more careful. They have to take preventive medications. So that is why those patients who are diabetics, we say that they should be taking cholesterol reducing medications even if the cholesterol is not high. That is very important. Those patients who have high blood pressure, they should be taking cholesterol reducing medications much earlier than those patients who are not having high blood pressure. Then those people who have family history of heart disease, those who have any previous problems of heart, etc., all these people must be taking cholesterol reducing medications so that the cholesterol deposition process doesn't happen inside the heart.
And nowadays, a lot of us millennials are eating junk food, processed food. So, what happens when you're eating a processed food? How your heart is affected because of that processed food?
Yeah, so basically, as far as the processed food is concerned, what is processed food? Processed food is any food which contains added sugar, added salt, or added oil. This is processed food. So this is, people have to understand. It is not only that a pizza is a processed food or a burger is a processed food, which people understand. Anything, like for example, Maggie is a processed food.
Right.
Maggie contains a lot of salt, which is a very common edible item now in Indian households. Taking Coca-Cola, taking Pepsi is a processed food. It contains a lot of added sugar. Then juices which come in the Tetra packs, they contain a lot of added sugar. So basically, all those food which is kept on the shelf and is having so much of sugar and salt, all that has to be avoided. Deep fried items also to be avoided, and of course, frozen foods is another new entity which is entering into our houses now. People are now
Yeah.
eating frozen, fries, frozen many other snacks. All those are containing too much of salt and too much of oil.
Okay. So, salt is the main culprit here. Like, if you
Salt
look
and
at the
sugar. Salt and
salt,
sugar.
salt and sugar. Okay. Okay.
Sugar is also.
Um,
Yeah.
Okay. So, are there any easy to do exercises that you recommend to your patients if they come to you, saying that I have a chest pain? Easy, like if I'm sitting on a chair, do you suggest anything that we as millennials should do? Because we are always out and about, college, office. So, what exercises we can do?
Yeah, the easy exercises which we can prescribe to our patients generally is that walking is the easiest thing to do and the cheapest thing to do. So walking for about 35 to 40 minutes every day at a pace of about walking a kilometer in 10 minutes or 12 minutes is a good exercise. And if one does that on a regular basis, 4 to 5 days a week, very good. Apart from that, doing yoga, doing other physical exercises like stretching, and doing some isometric and isotonic exercises is also a good idea. So muscle mass should also be built, because muscle mass keeps you healthy for a longer period of time.
Right. So now you've mentioned a very important point. I think a lot of us are just focused on losing weight, losing fat, but we don't focus on building our muscle mass. We lack out on protein. So I think that that is very important that you eat protein to build that muscle mass and have healthy diet. Right.
Yes.
Um, Anything else that you would now that I think we are done with a lot of questions, we needed to know the basic stuff because I'm sure now people understand what happens, what they should do if someone is have sudden heart attack, and what they should do for themselves in order to keep their heart healthy. So, any last note that you would like to share with us?
I mean, three things very important. First is prevention. Prevention is something which is very, very important. People don't take steps for preventing a problem. When it starts hitting, then they become, very aggressive in doing all the things like not eating this and that. But all this should happen from the very beginning. Then diabetic patients should be more careful, hypertensive should be more careful. Keep taking your medicines on a regular basis, keep everything under control, then chance of having a heart attack is much lesser. However, the second point is that if somebody has a heart attack, he should be reaching the hospital within 1 hour, and the angioplasty should be done. Do not delay it. In the first 1 hour, if it is done, the chance of the person living for a longer period of time is much better, and the heart is healthier. So that is second very important thing. And those people who have already had a heart attack should continue to take medicines and lifestyle control for the entire life.
Okay. Thank you so much, Doctor. It was an amazing session. The live will stay on the Facebook, on our Facebook page. So I hope a lot of people watch this live and get information. Thank you so much for your time. I
Thank
hope we
you.
do a live session again in future.
Thank you.
Thank you. Thank you so much.
Thank you.